Life is a winding road, no telling where it goes. Driving through days and nights, won't stop for traffic lights. And I really wanna know if I'll ever figure out where the road goes. Even if I'm falling down, I will keep on searching for my highs. You can say I lost my mind, I will keep on holding my head high. Even if the sky is falling down. Jumping from cliffs so high, trusting our wings to fly. Sometimes we're crashing down, but we get up and start from the ground. And I really wanna know if I'll ever figure out where the road goes. Even if I'm falling down, I will keep on searching for my highs. You can say I lost my mind, I will keep on holding my head high. Even if the sky is falling down, even if the sky is falling down, yeah. The sky is falling down. Even if the sky is falling down, even if the sky is falling down, yeah. The sky is falling down. Life is a winding road, no telling where it goes.
Welcome to Ask Dr. Geier Live. Wherever you're watching, hope you're making today your masterpiece. It is that time, 12 p.m. Eastern time, where I answer your questions, whether they're health and wellness, whether they're peptides or exosomes or penicillin or some of the innovative anti-aging orthopedic treatments I talk about, whether it's just an orthopedic injury or surgery or rehab or recovery. This is your chance. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, anti-aging and regenerative medicine expert, and media medical expert. I help you feel and perform your best regardless of age or injury. As always, please remember, I am not giving you medical advice. I'm giving you answers for information and educational purposes only. I haven't seen you, I haven't examined you, I haven't looked at x-rays, MRIs, any of that, so I can't give you medical advice. Plus, that's not allowed legally, at least here in the United States. I don't know about other countries, but we cannot do that. So, use this information to better understand your injury or surgery or whatever it is. But then maybe you take that information to your doctor, to your orthopedic surgeon, and then say, hey, what about this treatment? Or what about that treatment? Or I've heard that treatment doesn't do so well. Whatever it is, feel free to use that information however you want, but I am not giving you medical advice. If you do want to come see me as a patient, there's information in the description below about how to do that, how to contact my assistant to help set that up, and I'll talk about that a little bit at the end. All right. Frequent contributor, Jagadish, pus discharge from my wounds, physician Vicro reaction, any chance of reaction again, even if it was removed by the physician. Typically if that's what this is, and why can I not get your thing off the screen? So what he's talking about, and if I remember, it was an ACL surgery that he was talking about, pus coming out of the wound. And Vicro is a type of suture under the skin that holds the skin together. Typically, it's not so much a reaction to the suture. I mean, I guess it could be, but you get a little stitch abscess. It sort sort of collects a little pocket of pus right around that, and then it sort of leaks out. So it's not necessarily that the suture's in place. In fact, Vicro is an absorbable suture, so it will go away. I don't know how far you are out from surgery, but Vicro typically dissolves in 4 to 6 weeks. So well after the skin is healed, fortunately. But no, typically it's more that it collected under the skin, it gets out, and then it's okay. Now that again doesn't get to the fact that it's possible people have a deeper infection, like I talked about last week, or whenever that was in response to a similar question. But typically, no, it's not a reaction to the suture, and the suture doesn't need to come out. Mary says, I like your shorts, 30 seconds on YouTube. So it's interesting you say that. My assistant that really sort of manages my social media had been pushing me to do that for a while on Instagram. And so we started, and very quickly we were like, well, if we're going to do them for Instagram, we might as well put them everywhere that does short videos. So on TikTok, even though I don't spend any time on TikTok, but the videos are posted there. Instagram Reels, YouTube Shorts, and I think she puts them on Facebook Reels as well. Yeah, they're fun. Sometimes they're like what I do in my long form videos on YouTube, where I'm just talking, explaining an injury or answering questions. And then sometimes they're out somewhere talking about exercise or whatever they are. So I really appreciate that, Mary. We are about to resume more long form videos on YouTube, not live, but where I will talk about a topic or answer a question as part of a video that stays up forever. Those will probably start, if not next week, the week after. So those are coming for what that's worth. Any other questions? If you have any, I'll stay for a couple more minutes while I'm doing that. As I've said a couple times in recent episodes, if you have knee pain, we're looking for 5 patients with knee pain who want to get significantly better in the next 30 days without surgery, without cortisone shots. If you're potentially interested in that, there is a link in the description. Go to that link. It takes you to my contact page. Put your name, email address, and then in the description, all you have to type is the word interested, and my assistant and I will be in touch to talk about potentially what that entails. One of the questions I get with people that respond to that is it something that can be done by telehealth or virtual? No, you would actually have to come to our office outside of Charleston, South Carolina, because some of the treatments can't be done where you just ship somebody medicine. Not that you can do that anyway, unless you have a license in every single state where people potentially would ask that. But more importantly, some of the treatments need to be done on site. So that's what makes that kind of hard. All right, last question for this Friday comes from Mike. Insertional Achilles tendonitis, BPC hasn't helped. What should I try next? Yeah, before I get to what could you try next, I'm going to I started to do this last week, and I've done it off and on. So I feel like peptides can be helpful for a number of things, and potentially can be helpful for Achilles tendonitis. In my experience, peptides are something that get people 10, maybe 20% better. It depends on the injury, depends on the condition, depends on the peptide, how long it's been going on. There's a lot of factors. Peptides are not the game changers in my experience, and having 3 board certifications and a peptide certification from the American Academy of Anti-Aging Medicine and the International Peptide Society, my experience is that they get people a little bit better. They are not the game changers that are being pushed online. I feel that a lot of the sites that are talking about how great they are have a vested interest in doing that, either by selling them themselves or getting a referral or affiliate fee from the sites that do sell them. And again, I've said over and over and over online, do not buy peptides online. They're almost certainly fake. No peptide in it, and they often have contaminants in it. You don't know what you're getting. You're largely wasting your money. Get them from a doctor who gets them from a 503C FDA-approved pharmacy, and that is the safer way to do it. Having said that, back to your original question. Oh, and as far as peptides go, I feel like peptides work best, whether it's for arthritis or tendon injuries, muscle injuries, whatever it is, as a combination of treatments, using different things to target different aspects of the injury, stopping the damage, rebuilding the tissue, supporting the structures around that area. And so any one thing, in my experience, doesn't typically make a huge difference, whether that's BPC or penisin polysulfate for arthritis or a number of other things. As far as other things you could conceivably try, for insertional Achilles tendonitis, I feel like like shockwave therapy can be fairly helpful. It's not a one-time thing. You'd have to go and do it weekly or even twice a week, and sometimes 3, 4, 6 weeks. But I feel like that can be fairly helpful, and there are studies that show that can be helpful. They're typically case series, but still, there's no real harm done. And it really isn't that uncomfortable, quite honestly. Other things, potentially PRP injections into the area of Achilles tendinosis, exosomes, I feel like, injected into that area, also potentially try to get that tendon to heal. So those would be some of the things I'd kind of think about. And then, all right, I said last question, but I'll do one more. If I can get it to appear on the screen, Jagadish, if I can't, there we go. Will I assume second degree MCL heal on its own? Yes, it should. The only type of MCL injuries typically that don't heal are ones where it pulls off the tibial side, the shin bone side, and that whole end of the ligament flips basically on top of the hamstring tendons that attach right there, and then there's no way it can heal back down to bone. That typically doesn't work, and you have to fix that fix that surgically. Pretty much all other MCL injuries heal on their own. You have to protect it, usually some sort of brace to eliminate varus and valgus stress. Usually that's enough, quite honestly, but sometimes you might add some other things to speed that up. But yes, typically that does heal without surgery. And Mike says, thank you, you're very welcome. That is all I've got for you. Again, if you have knee pain and you're potentially interested or have any kind of injury and you don't mind coming to Charleston, South Carolina, it's beautiful. It's a little rainy today, but that got rid of a lot of our pollen, so I won't complain about that. But it's a great place, great restaurants. It's on the ocean. Everybody loves Charleston, so definitely come this way. And yes, you are very welcome. I appreciate that. But you're welcome to come see me. Having said that, I hope you have an amazing weekend wherever you are. I look forward to seeing you again in longer form videos and the YouTube shorts if you follow me on YouTube. If not, I will see you hopefully again for a future Ask Dr. Geier Live. Have a great rest of your weekend.